Welcome everyone to today's Public Health Essentials for Health Department session focused on retention programs. I'm Christine Ganella. I'm the Executive Director of the Pennsylvania Public Health Association and Managing Director of Strategy Development with Public Health Management Corporation. Today's webinar is being hosted by the Pennsylvania Public Health Association and Public Health Management Corporation with support from the CDC Public Health Infrastructure Grant and the National Association of County and City Health Officials. The Pennsylvania Public Health Association is the state association of the American Public Health Association and seeks to advance health in all policies through the Commonwealth of Pennsylvania. Public Health Management Corporation represents the Public Health Institute of both Pennsylvania and Delaware and seeks to build healthier communities through partnerships with government, foundations, businesses, and community-based organizations. Public Health Management Corporation fulfills its mission to improve the health of the community by providing outreach, health promotion, education, research planning, technical assistance, and direct services. Just a couple housekeeping items before we get into our webinar today. Today's webinar is being recorded and will be available in the next day or two on our learning management platform. Additionally, a link to the recording will be sent to all registrants. All participants will be muted throughout the presentation. We will encourage our participants to submit questions during the presentation. To do so, please use the chat tab on your Zoom control panel, and it will be relayed to the presenters and answered at the end of the webinar. To enable captions, please click on the closed caption button along the bottom of your Zoom window. You will see the option to enable live transcripts. A post-webinar survey will pop up at the end of the webinar. Please take a few minutes to complete the survey evaluating this live webinar, as your feedback is critical to the ongoing development of our webinar topics. Today, I'm pleased to introduce our speakers for our webinar, both Audrey Tellez and Ashley Edmonston. Audrey is the Public Health Program Manager at PHMC. Audrey supports PHMC's Technical Assistance Hub for both Regions 2 and 3 of the CDC Public Health Infrastructure Grant. Audrey interfaces with our state and local health department partners and helps to coordinate our public health institutes and our training centers and collaborates with national partners. Audrey began her career in public health and her career was centered on harm reduction, HIV prevention, and sexual violence prevention. And Audrey pursued her master's in public health at the University of Pittsburgh. And Ashley is the Director of Workforce and Leadership Development at the National Association of County and City Health Officials, or otherwise known as NACCHO. In her role, she oversees a portfolio of projects and programs designed to build workforce and leadership capacity in local health departments, including NACCHO's Adaptive Leadership Program, Management Essentials Trainings for Managers, a new program for local health officials called RISE, and numerous tools and resources related to recruitment, retention, and training. Ashley also oversees NACCHO University, a learning management system devoted to content targeting the local public health workforce. Ashley received her MPH from Johns Hopkins and lives in Alexandria, Virginia, and loves theater, hiking, and baking. I'm pleased to welcome both Audrey and Ashley to today's webinar, and I'm going to transition the webinar over to Audrey.
Thanks so much, Christine. And my goodness, it's great to be here with everybody. I see a lot of familiar names coming through the chat, and yeah, just in general, it's always a busy time, so we appreciate you joining us for the discussion today. To get us started, though, you just heard a good bit about Ashley and I, but we'd love to see a little bit about where you all are coming from. So we have a poll that I think Hayden said she could launch. Just a quick look at, who's in the audience and what kinds of organizations are represented. So as you're kind of taking a peek at that poll, I did want to acknowledge that, this work is always important. Retention and how that looks in health departments. We engaged in this work mainly in partnership with a lot of health departments. I'll pause myself. Okay, we have a good bit of local and state health departments, nonprofits, public health institutes, other orgs as well. If you are someone that put organization type not listed, feel free to drop in the chat where you're coming from. Thanks for being here today. But yeah, so just calling out that, so much is happening in the public health space. retention is always incredibly critical and important. But yeah, just thinking about this, and Ashley, it was a good question you had asked the other day when we were prepping for the webinar of, what does that look like now? How's retention, how's workforce related work resonating at this moment with the public health environment that we have and all the challenges that we're up against? And so thinking about this, my goodness, there's things that are different, but these retention related aspects are probably ever more important. Just supporting our staff and our public health infrastructure in the ways that we are able to at this time is immense. So just want to start with that. As far as objectives go, we're excited to reflect on reasons for health department staff resignation alongside you all, which will lead us into kind of the opposite. What are these core concepts of employee satisfaction? So what does that interplay look like? Also talking about a huge topic, work culture. How do we think about it? What is it exactly? And how do we promote positive one? Also, one of my favorite things about working with health departments is you all ask great questions like, well, how can we make this actionable in our health department? So in partnership with you all, we've created a resource guide that shows initiatives that improve retention and actual programs that you can consider that we'll talk about a good bit too. So to get us started, we'd love to hear from you all about what comes to mind when you think about the top reasons for employee resignations in health departments. So I encourage you to drop some ideas in the chat. You should see the option to send your chat to everyone in that blue Zoom dropdown. So just make sure that's selected. And then, yeah, share with us the ideas that you have. Yep, Tony hit the nail on the head. So higher pay in private sector. Okay. See if other ideas come through. Compassion fatigue. Salary and working conditions. Burnout and pay, for sure, for sure. Give a couple more responses here. Opportunities for promotion. Totally. Well, as folks are contributing to the chat, we can go to the next slide. You all are naming the top reasons for health department resignations. Most notably, of course, pay being the top factor. But really thinking about, reasons 2 through 7 on this slide, these are things that we do have a little bit more within our scope of control in impacting. So we might not be able to impact pay always, especially in health department systems. It can be really challenging to make movement on that, especially to Tony's point in the chat. If we have competitors in the private sector that can just pay more, that's an immense challenge. But look at these other things. We have work overload and burnout, lack of opportunity for advancement, stress, our organizational culture, job satisfaction, lack of support. These are not by no means easy things to influence, but they are more within our control to contribute more positively too. So that's what we're going to focus on mainly for today. So let's get started in digging into, okay, well, what are those core concepts then to employee satisfaction? So kind of the flip side of resignations, why do people stay? So we have these 3 components listed here. Employee engagement, safety, and a positive organizational culture. So for employee engagement, employees are identifying with, have a role in, and are committed to health department mission and goals. How many of us remember joining, a new organization, and that first day you come and you are so excited, you have ideas to bring to the table, and you're filled with passion. So many of us in public health, that's the reason why we're here. So really, what is that connection then with continuing that energy? How do we support employees in continuing to feel like their ideas are heard and they are contributing to that broader mission of their organization? Safety, of course, physical safety, but also psychological safety and agency and respect. Do we have a trauma-informed workplace? How does that contribute to how safe we feel at work as well? And then the big one, a positive organizational culture. How do we do that? How can we make sure our org cultures are supportive and collaborative and communicative, as we know that does wonders for facilitating a positive work environment? So we're going to hone in a little bit closer on each of those core components. So what does employee engagement really mean and look like, and how do we break that down? So here's a few components of that specifically. So meaningfulness. One is feeling valued and appreciated at work, feeling seen for the value that they're contributing, and consistently that is being acknowledged. Psychological safety, we'll talk about this a good bit. Safety was one of those previous components. It also influences employee engagement. So just that feeling that one can work without fear of negative consequences at work. And availability of resources. Do you have what you need to do good work? Whether it be physical things like the right software or tools, maybe it's the right amount of teammates around you to support the workload. Maybe it's just having like the mental space to accomplish what you want to at work. And safety, so that third core component. So breaking that down into these two different levels, and of course we've already referenced psychological safety, but this concept as well, institutional betrayal. So that is when a trusted institution does not act in a supportive manner or mistreats an individual. So an employee within a workplace, you might start off with a trusted relationship with that institution, but if there's somewhere along the line that trust is broken, that's going to take repair to be able to make employees feel safe and supported at work. And then, yeah, that dynamic of psychological safety, once again, how many of us have been on a team where it was encouraged and made a norm to share whenever you had a mistake or something didn't go well? And my goodness, how good that feels to feel like you can be honest about your work and brainstorm with your team to problem solve or grow or learn from it. And then the flip side is true as well. If that's not a norm on a team, that has consequences of, yeah, impacting how people feel at work. So organizational culture. So this is that one that, yeah, how do we influence something that feels so big? I have a definition here that I liked from Indeed that breaks it down a little bit. It says organizational culture is the collection of beliefs and values and methods of interaction that create the environment of an organization. My goodness, that's a lot. We're at that level of, kind of foundational beliefs that an organization probably shares in their mission, but also how's it lived out? How does that feel at the employee level? Is that the way it feels for employees? Do they feel like the mission is representative of their experience? So yeah, just this idea that organizational culture encompasses these foundational values, reflects an organization's expectations and philosophy, and the experiences of the employees being central to that as well. So what's it look like then to have a really good organizational culture? So those of us who've experienced it, you could probably share that there was little drama and minimal distractions within the workplace. There's also probably feelings of collaboration, an emphasis on productivity, but in a way that was a good balance where employees could feel supported in their own strengths and growth, employees feeling respected and, that there's empathy in the conversations that they would have. Also, that there is an encouragement of open and honest communication among employees and with management. And also, this org culture probably incorporated employee acknowledgement and recognition as a standard practice and something that was commonplace. So, yeah, incredibly important pieces of that puzzle. And so, on the opposite end, what does it feel like to have a more negative or toxic organizational culture? And what does that really mean? So, that word gets used a lot, so we'll have a little bit of a breakdown on this slide of what that is as well. So, I mean, for starters, an organization's culture influences every interaction and work products. So nothing that we talk about the rest of today will really matter if you're implementing a program or you're trying a new, approach. If you're not getting at this foundational level of how does, the organization really, feel for employees, it's going to be hard to be successful. So you have to really make sure that this is part of how you're thinking about programming, how you're addressing employees' satisfaction or dissatisfaction with certain pieces and trying to work together to see what can be done to build out a more supportive culture. You'll see some of these bullet points, that second one saying that, any kind of attempt to increase socialization among staff, whether it's, staff lunch or after work get-togethers, those won't feel like enough if those more foundational pieces aren't being addressed as well. It can even backfire as being viewed as a superficial attempt at improving employee happiness while ignoring those bigger issues. I'll call out with the third point too. I mean, wellness programming. I know that's something that we focus on a good bit too, just thinking about how do we support our workforce. While that is an incredible addition and immensely valuable in the terms of retention and these more system level pieces, it also will fall flat if those fundamental reasons are not being addressed. So once again, incredible to add in these pieces, but making sure that those, more system level things are being thought of as well. Seeing some love in the chat. So, once again, one of my favorite parts about working with health department partners is the question you ask of how do we make this actionable? What can we actually do? If we all agree that these things are true, what's the next step? So the way that we created the retention guide that we are talking about today and we're drawing content on for these slides is really informed by programs that you all had come to us and asked, hey, are there best practices related to X, Y, and Z? Could you help share them? So that's what we'll focus on going forward, is just what programmatic approaches that you can consider within your workplaces to make a difference. You'll see on this slide, we have different initiatives to advance department culture specifically. So this idea of culture transformation, state interviews is a really cool tool and framework, not only interviewing staff who leave and getting their feedback on why not interview the people who stayed? And is a positive contribution to why you're here still? Appreciative inquiry, once again, just having a deep level discussion with employees to understand, what is they're up against in their workplace. A really great example of this is the Joy in Work, What Matters to You conversations. Super excited to be turning over the mic to Ashley soon for her to talk more expansively of joy in work, but that being a part. Of course, having a trauma-informed workplace in mind, what can that look like? Employee resource groups, how do we stand those up? How do we promote a culture of diversity, equity, and inclusion and partnerships as well? So that's where I will start to turn things over to Ashley. Ashley, it is such an honor to have you here. Thanks for joining us, and yeah, take it away.
All right, thanks so much, Audrey. That's a great segue. Hello, everyone. It is very nice to see you. I am very sorry, but I will be off camera, unfortunately, for this presentation. I have a very minor eye injury, but I want to save you from the visual. So luckily, I have many beautiful slides that you can look at instead. But thank you so much for having me, and I'm excited to talk with you all about joy in work. Next slide. So the goals for my part of the presentation is I want to just briefly review the Joy in Work framework with you all, just in case you have not seen our toolkit online, just share out a little bit about what it's all about. And then take a little bit of a deeper dive on psychological safety, which is one of the domains within Joy in Work that you've already heard a little bit from Audrey as well. And then just talk about a couple of different strategies and methods that you all can take away to begin incorporating and implementing some of the joy in work practices into your workplace and organization. Next slide. So just to start off with a little bit of a reflection, I'd invite you to use the chat if you'd like to share, but if not, just to kind of think about when was the last time you had a meaningful conversation at work? And what about that conversation made it meaningful? Who was it with? What kinds of questions were being asked? What kinds of topics were you talking about? How did you feel? How did the other person feel? And how did you feel not just during that conversation, but maybe, 5 minutes after, 5 days after? So just to kind of think on that a little bit as we're thinking about these issues around meaning and purpose. Next slide. So I'm not going to go through all of these stats. You just heard several from Audrey as well, but essentially, the workforce has been struggling for the past couple of years, as we all know. And just to give a little bit of history around how the Joy in Work framework came to be at NACCHO, it was actually through our adaptive leadership program. We have a 7-month cohort called the Adaptive Leadership Academy, where we take participants really through our adaptive leadership principles and practices. And this was in 2022 when, a lot of health departments were really struggling with COVID. They were having to mobilize many of their staff around the COVID response. So many people were very overworked. They were overburdened. They were facing issues around harassment. There was just a lot that was really affecting their morale. And so for our participants in our Adaptive Leadership Academy, many of whom were local health officials, the adaptive challenges that they were bringing was around this topic. It was, what can I do with my staff during these times of uncertainty? And so the team came across this framework that was actually developed by the Institute for Healthcare Improvement. And it was fantastic, and it seemed to address a lot of these needs. And so we reached out to them and had some great conversations. They were very much on board with us being able to take this framework and make some customizations for more of a health department audience, because IHI's audience was really more of the healthcare space in hospitals and clinics and just more of that clinical environment. So we were able to work with them to kind of create this more tailored version specifically for the governmental public health space, which is what you see posted to our website. I will say I think it's interesting now that, we're also now in a time of uncertainty, a time of where morale is very low, and especially leaders are having to think about ways to help address either their organization's morale, their team's morale. A couple of years ago, at the height of COVID, a lot of it was around issues of feeling overburdened and really around the COVID response. Whereas now what we're hearing a lot more of is around feelings of uncertainty and how to support staff during feelings of uncertainty and kind of what that looks like. So, I think that this framework, hopefully, as you see, can be helpful no matter what the environmental changes are that you are having to navigate as a leader or as a team lead or as a supervisor. Next slide. And one more. All right, so I will kind of just briefly go over this to let you all kind of get to know the framework as a whole a little bit. So the framework includes 9 domains that you see around the edge of this circle and those little pie slices that represent the essential components that need to be addressed in order to create joy in work. And then around the outside, you see the different players involved. So the senior leaders, the managers, and individuals. And so ultimately, this is a framework around culture. So, you do need those folks who hold the authority and those folks at the top to make the decision to implement this framework and those practices. And this can be done organization-wide, but depending on the size of your health department, it might actually be difficult to implement something like this across an entire organization. So you do need to bring it down and really tap into, department heads, division heads, team leads, etc. And then the individual line is important because it does require really individual level commitment and awareness from everyone to make this successful. And also, before we dive into the 9 domains, I want to talk about what this idea of joy is kind of in work. It's called the Joy in Work Framework. But when we talk about joy, we're not necessarily talking about being joyful and happy and positive all the time. That would be great. Not necessarily very, very realistic. And so when we talk about joy, we're really talking about something that is created from feelings of meaning and purpose and value. So you as an employee feel valued, and you feel that your work and that your contributions provide meaning and purpose, which in turn creates a sense of joy. And so this framework asserts that attaining and maintaining joy in work really is an active process that must be worked towards across our agency. It must be intentional. So organizations can choose how to implement an approach to work on these. You may want to start with a component, for example, that you think needs the most attention within your organization, or you may choose to begin in an area that's already had some positive results from previous efforts. So kind of bringing in some of that appreciative inquiry or a more strengths-focused approach. So I will go ahead and talk through each of the domains very quickly. So physical and psychological safety. So in physically and psychologically safe environments, people feel secure and capable of changing. They are free to focus on collective goals and problem prevention rather than on self-protection. Next. Meaning and purpose. So with meaning and purpose, staff have the ability to connect their daily work to their impacts on their community and the people that they serve. Next slide. Choice and autonomy. So with choice and autonomy, the work environment supports choice and flexibility really in the daily lives and the work of staff. This is often the most overlooked domain, just as a heads up. Next domain, next slide. Camaraderie and teamwork. So key aspects of social cohesion include staff having mutual support and companionship, and really being able to build a collective sense that each person is part of a team. So we are working together towards something that is meaningful. And building social cohesion really focuses on the quality of those work relationships. Um, Wellness and resilience. So taking care of yourself is part of a larger systems approach to join work. It's not just a standalone solution. Promoting and modeling self-care behaviors are very helpful methods to improve joy in work, not just for yourself, but also for others. Next slide. Recognition and rewards. So traditional approaches for recognition, such as office parties and free food and bonuses, are fantastic, but have actually been shown to have limited overall effectiveness. It's really more beneficial to consider how you celebrate your staff and what you're celebrating, as well as ensuring that you're celebrating people in a way that they want to be recognized. So, how are you reaching out to discover individually what is meaningful in terms of their recognition and how do they want to be rewarded? Next slide. So participative management. So participative leaders do three things. Number one, they engage before acting. So they involve others in the beginning stages of an initiative to explain why the work is needed and gain commitment before implementing changes. Number two, they inform. They keep individuals informed of future changes that may impact them, including letting people know what is still unknown. And three, they listen. They encourage staff to share and listen to individuals at all levels in the organization. They consistently listen to everyone and not only when things are going well. So as a leader, it's critical that you listen strategically, and also don't ask for feedback that you aren't necessarily going to use. Next slide. Daily improvement. So the organization uses improvement science to identify, test, and implement improvements to the system or the processes. Improvement science entails making specific, measurable, small changes to address a challenge and to learn more about the issue of hand. So we think about this, I think, in public health a lot as continuous quality improvement. Next slide. Real-time measurement. So measurement systems can enable regular feedback about systems performance to facilitate improvement. So daily, weekly, monthly feedback is essential to effectively track data and gather data that you can use into that ongoing improvement. And the What Matters to You conversations is actually a great way of being able to get that feedback. So those were the 9 domains. I know we went through that probably very quickly, but just a couple of initial reflections. Again, if you would like, I would love to hear any thoughts you have in the chat. But thinking about the working conditions in local public health departments now, which of the 9 domains do you think need the most attention in the public health workforce? And then also thinking about the work environment and your organization. Which of these 9 domains is your organization most successful at addressing? Which ones have you started addressing? And then which of the 9 domains are most critical for your organization to work on to create a more joyful workplace? So kind of what has resonated with you so far in thinking about the environments that you're working in, both within your organizations, but within kind of the field of public health, larger scale. And as you're thinking about that, we can move on to the next slide. So a great way of approaching this is to start with what matters. So engaging in a conversations that matter is a wonderful technique of getting some of that feedback from staff and to be able to use that to think about what domains you might want to be focused on or to start identifying some of these strategies. So here are 4 questions that are a great way to start this conversation. So, what makes for a good day for you? What makes you proud to work here? When are we or you at our or your best? And what does that look like? And then what gets in the way of a good day? These are conversations that can be had one-on-one between a supervisor and a supervisee. These can also be had within a group environment or on a project team. There's many ways that you can have these conversations, but really the purpose of these is to get at what makes people really excited to come to work and do the work, and what does that mean for them? And to the extent that we're able, what gets in the way of that? So that's where this idea of what are some of the pebbles and what are some of the boulders come in as well. So pebbles are kind of small barriers that might be easy to address quickly. Boulders are some of those larger challenges that might be more systemic in nature, for example, that might take a longer time. And it's Oh, can we go back real quick? It's great if we can identify both, but I would encourage you to really try to identify at least a couple of pebbles if you have these conversations, because having some of those quick wins is really important. And I'll give you an example of something that we are doing on my team, and see if this sounds familiar. One of our challenges or barriers that gets in the way of having a good day is the number of meetings that we have. Just way too many meetings. So we're looking at ways that we can address this, and we've come up with a couple of different strategies. Number one, we do no meeting Fridays, which has been helpful. Number two, we're actually going to start doing a meeting spring break. We have one coming up in May where everyone is clearing off the entire week of meetings, internal and external, to really focus in on their work. And actually, folks are so excited about this that they want to do it quarterly. So we'll see how the first one goes, and hopefully we can implement it more regularly. Okay, next slide. So again, just some time for a couple more reflections. What have you been asked about what brings you purpose and joy in work? Or sorry, when have you been asked about what brings you purpose and joy in work? Have you been asked? Are these things that you're already talking about in some way, with your supervisor, with your teams, with your colleagues? When have you been asked, or when have you asked someone what brings them purpose and joy? And are there strategies that you have used? What are you already doing within your teams or within your organizations? And then what strategies have you used to remove barriers to joy? As I mentioned previously, one approach to this work is to take that strengths-based approach. So what has been working for you so far, and how can you continue to build on that is a great way to think about implementing this. Next slide. Just to take a couple of minutes to talk a little bit about psychological safety. This is one of the 9 domains, and it's really one of the foundational domains of the framework, in that if you don't have psychological safety, it can be difficult to actually implement some of the other domains. And at the bottom, you'll see these three words, which are kind of like a process. So you assess, you commit, and then you test. So within each of the domains, you want to approach it like, what is our current state of psychological safety within our team or a department or our organization? And then how can we commit to a strategy? And then how can we test out that strategy so that we know if it's working or if we need to make any tweaks or changes? Next slide. So a couple ways to think about how to assess it. What does a psychologically safe environment look like? And there's many resources out there about this. Here are just a couple of ideas about how you might see it in action or what you might hear. So team members feel comfortable speaking up without fear of retribution. And again, this can be in a group setting or it can be one-on-one. And kind of along those lines, disagreements can be surfaced in healthy ways. So even if you have a team member who doesn't agree with something that's been proposed or has some concerns about something, are they able to ask those questions or propose some alternatives or share their concerns? If in your team meetings or group meetings, you see a lot of team idea sharing and a lot of collaboration, that's great. And, of course, just work productivity. Team members aren't afraid to make mistakes. They can be seen as growth opportunities. I have noticed, sometimes if I see a team member who might be procrastinating a little bit, which can happen. And, sometimes there's other reasons for things like procrastination and putting off work, but also sometimes it's because they are afraid that if they put forth a product that isn't seen as high quality or as good enough, that there might be some sort of retribution. So your ability to affect this, you might actually see an increase in productivity as well. Next slide. So just a couple of ideas for some strategies to build psychological safety. And I think this is especially important as a leader, because the leader, whether it's a leader of a team or a department or a division or an organization, it really sets the tone for a psychologically safe climate. So inviting critiques and constructive criticism from team members, ensuring that that space is being given, that they can share out. I think as a leader, holding ourselves accountable, making sure that we are keeping promises to the things that we say we're going to do for our staff and following up on them. Being transparent. And I think especially, acknowledging mistakes. If something doesn't go the way that we thought it would, or if we made a mistake in something, being open and honest about that can also encourage others to be open and honest as well. Vulnerability, being open about our own struggles and our own difficulties with work. And consistency. So showing consistent action, I think, in how we're showing up, and especially how we're showing up in ways that we have committed to showing up. Next slide. So just a couple of final reflections. After hearing about the framework, after hearing about a couple of strategies or things that you could do with the conversations or around psychological safety, what excites you about using this framework to increase staff well-being? And also, who would you need to engage in your health department to implement this framework? This might be something that you feel like you need to engage your health officer on, which would be fantastic. But if that's difficult, are there others? Are there other colleagues? Are there other peers that you can tap into, that you can collaborate with in order to implement at least parts of these within your own scope of authority? Next slide. And also, is there a commitment that even just leaving this webinar you can make today or this week? What is one thing that you can try to create a safer and more trusting environment? This one small action, either within a check-in with one of your staff or at a team meeting, or maybe a check-in with whoever is supervising you. Just think about just one small strategy or action that you can do. Next slide. And along those lines, if you need an idea, a great one is to ask a colleague what matters to you. So you could have just even a small version of the what matters to you conversation. So you can just ask them, what makes for a good day for you? What makes you proud to work here? When we are at our best, what does that look and feel like? Next slide. So we do have these two toolkits on our website. We also have a couple of additional resources as well to assist with implementation. The Join Work Toolkit kind of gives the overall overview. It also goes into the what matters to you conversations in a little bit more depth. And then the Join Work Implementation Guide was created in response to some feedback we were hearing from the field, just around more questions around implementation. So it kind of goes more into some processes that you can use, as well as some deeper dives in some of the domains to identify some strategies. It's actually aimed more at management level. So recognizing that not every health department necessarily is going to be able to have the health officer be the one to completely implement this, but that should not stop you from doing parts of this. So as a manager or as a team lead, what does it look like for you to be able to implement pieces of this, as well as some tips and strategies to influence maybe other parts of the organization as well to get other people on board. Next slide. So beyond Join Work, I also just wanted to share a couple of resources if you are not too engaged with NACCHO. Here are some other things that you might be interested in. So please consider join our virtual communities platform. It's essentially a collection of discussion boards where folks can ask each other questions. You can share resources. Our all-member community is open to everybody. I think we have around 25,000 or so people on there. So it's definitely a great resource. For any local health departments, please consider joining a NACCHO work group. We have, I think, close to 40 work groups on various topics, and applications are actually opening in April, so very, very soon. So keep an eye out for those. Of course, we have our annual conference coming up in July. It's going to be in Anaheim this year. Also a great place to be able to network and just hear about best practices from other local health departments. NACCHO University is our learning management system, so it's a great resource to look for some of the trainings, and we also keep our recorded webinars on there as well. And then finally, subscribe to a newsletter. We have several newsletters. Some are monthly. We have at least one quarterly publication. And then our News from Washington actually comes out weekly. And I saw a couple folks I think are also from state health departments as well. If anyone's going to subscribe to anything, I would highly recommend News from Washington, especially at this point in time. It gets a little bit more into the updates on the legislative side and kind of what's going on the Hill and what it means. But it also shares out many resources as well. Next slide. All right, and that is all. Thank you so much again for inviting me on to share a bit about the framework and the resources. If you do have any questions or just want to chat about any of this, please shoot me an email. I'm always happy to hear from you. Thank you.
Goodness, thank you, Ashley. Such important and awesome content, and we'll be the first to say too, in-house at PHMC in our department, we had a day where we reviewed the Join Work content and we tried out the What Matters to You conversations, and it's been immense just for getting our wheels turning of how we can, just be thinking about having those conversations and moving our work forward in a way that our environment can continue to be kind of improved, and just having the time to talk about it. So just want to say those questions that you provide in the Join Work Toolkit, obviously designed from the adaptation for local health departments, but my goodness, they were great to use in-house at our organization as a public health institute, and no doubt would be helpful for anyone in a territorial or state health department and beyond. So just thanks again for all the work you all have done with that. So to take us home with the remaining minutes we have today, we'll talk about a few just remaining pieces and some of those more, kind of nuts and bolts programs that will be highlighted in the retention guide that we put together. Before I get into that, I see she's on the call, so I want to get Robin Wilcox a major shout out. Robin has been a really dedicated partner and helped stand up the retention guide that we will be publishing and posting, and it is immense work, Robin, that you've done on that. So just want to say thank you for everything. Also want to give IPHI a shout out, seeing some partners from the Institute for Public Health Innovation who've also been great thought partners in the retention work and have been doing an immense amount of work with a resource inventory that's bringing all of these resources, all of these organizations have been passionately putting together into a shared space as well. So that being said, we cannot talk about retention if we don't talk about recruitment and hiring, of course, as well. So retention really does begin with a positive hiring experience. I know in past positions, I have funny stories of, your first day at work, maybe not having a laptop ready or an office prepared, or just not having those things that really communicate the value that you're about to bring to the organization. And yeah, it really should feel like an exciting time, both for the department and also the new hire. That's the first impression that employee is getting with their relationship with this institution. So just having that connection in mind too of, okay, what does it look like with our hiring processes? Are people having a positive experience? Are they feeling affirmed as they enter our organization? And also knowing how long hiring process can take. It can be so well worth your time, obviously, to making sure that folks feel that they want to stay at this organization and that, all the time you're putting into hiring pays off with someone who's able to kind of continue on with your team going forward. Last, I have this quote. I can't remember who told it to me at some point in life, but just always kind of resonated. If you're not onboarding well, you might as well be offboarding. So you can head to the next slide. So financial initiatives. So I know we talked about, obviously it's a big barrier a lot of times to be able to make moves with salaries and pay. But if there is the opportunity to dedicate smaller amounts of funding to other things, maybe it's a tuition reimbursement program, some kind of professional development opportunity that you could offer employees. This was a great idea that came from a health department partner of, oh, do we have any best practices for, setting this up? We want to do it. We want to include contracts that can help level set for employers and employees about expectations. And we have a partnership that we want to, kind of put together with a local college or university to get it going. A really great thing to offer. You might not be able to always pay a higher salary, but you can offer skill building and ways that employees can advance, which is amazing. Also, a request from a partner to have best practices for salary equity studies. So another, great way an organization can communicate that they care to employees to take a close look at salaries and identify where there might be inequities. Maybe systemic biases are coming into play with compensation, for example, with race or gender, or maybe there's just inequities for other reasons too within pay. But yeah, to put forth a salary equity study and be able to make good on that obviously would be an amazing asset to employees feeling supported. So other examples of professional development initiatives, developing career ladders so employees can see their own trajectory and growth and what they need to do to advance. Offering other professional development opportunities is always a great addition. Mentorship programs, my goodness, a great way for employees to feel supported. Maybe they have a great supervisor or a supervisor in general, but connecting with someone else in the organization who can be a mentor, maybe provide guidance in different ways or just be a safe space outside that person's department. That's a great addition to programming as well. And 360 reviews, another consideration for open feedback between employees and management as well. So all this to say, we delivered so much content in a short time. We're excited to be putting the final touches on some new products that we can share out more broadly so folks can review on their own time. Maybe there's a program or idea from today that really stuck out to you and you want to spend more time thinking on if you would like to bring that up within your organization, run it past your leadership, or if you are in that kind of decision-making space, using that within your teams. So we can head to the next slide. So we have all these ideas packaged within a guide for retention. So Public Health Department employee retention, a discussion and actionable recommendations. So a lot of the content we shared today is listed within this guide. We also have 10 one-page documents that give more of the nuts and bolts of how do you stand up a program if you're interested in mentorship programs or if you're interested in salary equity studies. We have one-pagers that are that more programmatic. These are some, nuts and bolts of how to do it. Yep, and that kind of high level description of each of those programs. So we really hope this guide can serve as you can get a quick snapshot of what each of these things are, and then you can jump to that place in the guide to give it a deeper read and see, how it could look within a health department setting. And so I referenced those 10 one-page summaries. So they cover these different programs. So if you have any interest in any of these and you just want to learn more, want to think about logistically what that looks like, there'll be one-pagers available for you to review. We also have more detailed briefing papers and slide sets that go with each of these 4 programs. Once again, developed in partnership with health department partners. And so if this is something that you'd like to bring to maybe leadership at your health department and would like some slides to communicate what it's all about, we have some that we made and are generalized for anyone to keep handy and use. So lots to summarize here, but I guess the crux of it, and Ashley did an incredible job in hitting this home through the joint work, is that really retention is about the work environment and the satisfaction employees feel about their work, and really asking employees about it. So any initiative that's planned really should be in step with employee input. You could plan a great initiative, but if it's kind of out of alignment with just how employees feel, it won't be received in the same way. It might not have the impact you would hope it would. Yeah, and then just, kind of thinking of these as more long-standing commitments, not just one-time events. So I'll turn over to Christine. Just want to say we'll let everyone know when those resources are posted. We're going to be getting them up on the Public Health Infrastructure Grant site as well as our own at PPHA, and we'll make sure to just circulate them through our networks too. So everyone should have those coming up in April. So I'll pause there. I'll turn it over to you, Christine.
Thank you, Audrey and Ashley. What a wonderful presentation, and certainly lots of opportunities to reflect and think about how we can use these tools in our everyday workplace, and certainly gave me a lot of ideas for both bigger scale implementation and impact, but also just sort of everyday things that we can consider. So thank you both for just this really thoughtful presentation and also just these wonderful tools. I will pause for just a minute. You're welcome to put any questions into the Q&A feature at the bottom of your screen. I'm happy to take a moment to answer any questions that you might have for our panelists. As Audrey said, we will make these resources available. Natalie did put into the chat, it looks like registration for our next webinar, which will be specifically around Penny and Pennsylvania's health insurance marketplace. If you're interested in learning more about Penny, what is on the horizon for marketplace subsidies, and some of the asks to Congress about continuing on with those subsidies, certainly tune in with our interview with Penny and what they are feeling like is most pressing for them as the PA Health Insurance Marketplace. So please feel free to join. Seeing no questions for our panelists, if you are not a member of PPHA and you're interested in becoming a member, please consider joining us. We have the QR code on the screen. You can access information about PPHA as well as all of our resources on our website. Follow us on Instagram, and we still are on Twitter, and we're actually on Blue Sky as well. So we need to update our slide deck and make sure that we have our Blue Sky account on there too. So I want to thank everyone for taking the time to join us today. We appreciate all the partnerships that we have developed with everyone, and hope that you have found today's webinar valuable, and the resources that we've presented, something that you can implement in your workplace. So thank you all for joining us today. Have a wonderful rest of your Thursday. Happy spring, and we hope to see you on our next webinar. Take care.